Yeah, as a OBGYN doctor, I always found that to even examine a person, it's a very privileged status that you're given as a physician. Even when I was going through medical school, our anatomy professor, who was teaching us anatomy on cadavers and preserved tissue, which has no life in it, the instructor would say, this is still a privilege for you to be able to handle this muscle and handle this bone. And this was a person, a live person, and they have willed or given up their body to medical education. And so it's a privilege for you to even be handling and learning the relationships and the muscle groups and the bones of the body from somebody who was once alive. It's all a privilege, and especially it's a privilege when they're alive and in the exam room, to be able to touch and to feel and to acknowledge what you're thinking to the client, to the patient. I mean, do you have that kind of relationship in your mind, Fred, when you're talking to somebody? You're relating to them more in a mental, emotional way.
Yeah. Two things. One is I'm really glad you shared that because I've always been in awe of doctors and surgeons, and it's such a sacred trust. The second thing is this is kind of comical, but I don't mean it to mock anybody or anything, but I've actually, after a really intense session, when we were uncovering layers and layers of painful life experiences and tragedy and grief and abuse, and then I've been providing that atmosphere of safety and acceptance of them, and trying to give hope that they can heal. It's going to be hard work, but they can heal. There have been times after the client has left, I've held my hands up like this, like a surgeon, and I say, I just did soul surgery. And I go wash my hands and sterilize my hands, for the next patient,
I like it. Soul surgery.
Soul surgery.
There you have it, YouTube fans. Fred actually does soul surgery.